Hello there.
Hi. Welcome to From Skirts to Scrubs. I'm Charlotte,
And I'm Alicia.
and we are two medical students trying to figure out our place in medicine by looking to the past and to current events to try and understand the impact they have on us as women in medicine and as women in general.
Yes, and you can find and follow us on social media. We have an Instagram and a TikTok, which are both at From Skirts to Scrubs. We have a Twitter, which is at FSTS_podcast. And you can check out our website for more information on our episodes, show notes, sources, merch, and more. And that's from skirtstoscrubs.com.
Yeah, and you can also subscribe to us and leave us a rating and review. Apple Podcasts and Spotify are great places to do that. We're also now on YouTube, and we have live videos of our recordings and our episodes. So be sure to check that out and give us a subscribe and a like on YouTube.
Yeah. Okay, so today we have a very special episode, slightly different from our usual ones. We are going to be discussing body image and this concept of body image and how it changes or is impacted by getting cancer treatments like chemotherapy. And this this topic is quite broad, but also quite niche. And we're covering kind of for two big reasons. So the first is that we're trying out this new type of episode where we do a little bit of like a scientific literature review on a topic, which we don't always do. We kind of pull from history, and there's not a ton in primary literature on history and the topics we are covering often. But today we're going to do like a very modern topic and look at the science behind it. And since we're going to be doctors, this is like a big part of what we do. So I thought it could be a fun new way for us to deliver information. And the second reason is way more fun and more exciting, but we have a guest on the podcast today who we are going to introduce now.
Yeah.
All right. So we are here with Madison Novice. We are so excited to have her as our guest on the podcast today. She is the co-founder of Cap and Conquer. She's also one of my med school classmates at the University of Michigan, and she matched into dermatology for residency. And over the course of the last 4+ years, she has been doing amazing work with her organization, Cap and Conquer, which aims to increase awareness of cold cap therapy and provide financial assistance for patients who want to pursue cold cap therapy, which we are going to talk about today. But also on a personal note, Maddie is literally like my soul sister. We are similar in so many ways. And it's kind of crazy because we think about things the same way. Our likes and dislikes are the same. And I've known her for 4 years now. And we've been talking about having her on the podcast for a really long time. And so we're so excited to welcome her. Thank you for being here, Maddie.
Oh, thank you so much for having me. I'm so excited and honored to be a part of this.
We are so happy to have you.
We're honored
So
to have
we're just
you.
going to jump into the episode and go from there. So I wanted to start by saying that body image is a complex topic that has a lot of factors contributing to it. And when it comes to cancer, I would be wrong to say that it's a one size fits all. There's many types of cancer and, of course, many types of cancer treatments. So, for example, in patients with breast cancer, which has been kind of the most common context that body image has been studied, there are lots of different changes that bodies go through. So there's potentially surgeries, which are different from the changes in body image that a patient may undergo if they have chemo. And so I wanted to be mindful of that distinction and also clarify that today we're going to be focusing mostly on the impacts of body image on patients who kind of undergo chemo and often experience alopecia, which is also known as hair loss. So when it comes to body image, we, as a quick definition, are talking about the picture of our own body, which we form in our minds. And this includes our expression of emotions, our identification, our self-identification, our beauty, and the social aspects that play into that. And researchers have studied various cancer treatments, including breast cancer treatment, head and neck cancer treatment, colorectal cancer with and without having a stoma or having a colostomy bag, and anal cancer treatment as well. And they've also looked into a lot of the side effects of non-surgical treatments like chemo, radiation, hormone therapy, and have looked at issues relating to these treatments like hair loss, lymphedema, which is like swelling of the lymph nodes, that can cause like skin changes, general skin irritation, pain, weight gain, and all of these things are issues that contribute to body image and how they change. But what we're going to be focusing on mostly today is alopecia or hair loss. And over half of cancer patients have identified that chemotherapy-induced alopecia is their most feared side effect of chemotherapy, with as many as 8% of women saying that they would contemplate refusing curative chemotherapy due to the possibility of hair loss. And lower self-esteem and body image also contribute in larger ways to sexual dysfunction in women, often in younger women, which makes a lot of sense. And there's been various kind of methods that have been trialed to kind of help folks cope or deal with their changing bodies, both psychologically, but then also medically. And so when it comes to hair loss, we've trialed things like minoxidil creams, which are creams that help stimulate hair follicles, vitamin D3 pills, scalp compression, and the latest innovation is scalp cooling therapy. And so I thought about explaining scalp cooling therapy, but since Maddie has way more
expert,
experience
Oh my gosh, I want to go that far.
I was wondering if you could tell us and our listeners about what scalp cooling therapy is and how it works.
Yes, and first of all, I'm sure you would do an amazing job. But basically, scalp cooling is also called cold caps. It's literally just a cold cap that patients wear on their head before, during, and after chemotherapy. And the idea is that the cold causes our blood vessels to vasoconstrict or become more narrow. And so that way, the chemotherapy doesn't go to the hair follicles and it prevents the hair follicles from getting damaged. So kind of that's the main way it works. People also say that because it's so cold, it almost puts the hair follicles to sleep, we like to say. So it slows the metabolism. So whichever chemotherapy agents do get to the hair follicles, they're not taken up as much at that place because they're less sleepy, you could say. More sleepy.
Very cool.
Yeah.
And that does make a lot of sense. And so we're wondering, you are very passionate about scalp cooling therapy and cold caps. Kind of what led you to found Cap and Conquer? We'd love to hear more about your organization and the work that you do.
Yeah, so it actually kind of for me goes back to I started volunteering. I went to Duke for undergrad and I volunteered coincidentally at the Duke Cancer Center boutique doing wig fittings for patients who were undergoing chemotherapy and who were losing their hair. And so from very early on, I had this unique experience where I saw just how much hair loss impacted the way patients saw themselves and the emotional distress that was accompanied with it. And I will say, kind of as a disclaimer, this again is not everyone. I would say most patients were very distressed during the wig fitting, but some patients were totally okay with it. And so it's really important just to kind of like to like normalize that anyone can respond in any which way that feels right for them. But for the most part, I do think that was very distressing. And so I saw that impact early on. Move forward 3 years, I was still at Duke. And this time I was actually the one at the Duke Cancer Center, same hospital, but this time being diagnosed myself with Hodgkin's lymphoma. And so I was also told that I too would lose my hair. And it was this really weird out of body experience where all of a sudden I was that patient in the chair that I've been helping for 3 years. I, of course, asked my oncologist, am I going to lose my hair? Quick answer, yes. And that was kind of it. I went on, I did fertility preservation, which is a whole topic on its own. And then I got a call from a family friend who said, I heard about your daughter, called my dad. I heard about your daughter. If she's able, she needs to use something called scalp cooling to keep her hair. It will make the biggest impact. And my family, I come from a family of providers, and we kind of said, we don't have time to worry about her hair right now. We're worried about her prognosis. We were still kind of working up which treatments to do. And I always say this because I say it because people think it, but in our minds, we were like, this is superficial to worry about hair loss when we're worried about her life. And we were so wrong. And I'll get to the fact that we were so wrong, but I was so grateful for our family friend who was like, no, you have no idea how important this is. It made such a difference for me. And if you can do it, advocate for your daughter and get it. And so I really had such a lovely advocate in my corner, my friend, who pushed me to use scalp cooling therapy. But there's so many barriers. First of all, I was lucky to have a mom who dealt with getting all the logistics set up for me to use the treatment. I had parents who helped fund the caps because it wasn't covered by insurance. And so it ended up being around like probably $3,000 all in during treatment, which most people don't have, especially during extra costs of treatment, of chemotherapy in general. And then it was a really long process. So kind of to rewind, scalp cooling, there's two types. So there's manual caps, which you change every 25 minutes throughout your chemotherapy day. So it can be for up to 8 hours. You're changing the cap every 25 minutes to keep your scalp cold. On the other hand, there's machine scalp cooling systems, which are less common, but those are actually at infusion centers. So those are easier because you just put them on once, they connect to a machine, it circulates this coolant and keeps the cap at the correct temperature. So I was at a place where I had to use the manual caps. And so my mom and my sister came, they changed my cap every 25 minutes during all 8 chemotherapy sessions that I required. And I was really lucky to have that support system. So you're just like seeing all these barriers rack up. So like finding out about it, someone pushing me to use it, being able to afford it, being able to have someone with me on treatment day to actually change the caps. And then it's a lot of work. And so I remember about 2 treatments in, I was so overwhelmed and I was like, I'm just going to stop. It's not worth it. In comes family friend again. She helped push me through the process. And because of that, I was able to keep my hair. And so I walked out of this treatment and I was 21 years old. My friends were in a completely different stage of life. They were in senior year of college. They were going out 24/7. They were like in an enigma of, I don't even know what they were living. And I was just in this completely alternate universe back home. And all of a sudden I had to go back to school. And it was so weird because I gone through this life change and now I was supposed to adjust back to this world in which I felt so removed. And having my hair it gave me such a sense of peace knowing that for me, one of the hardest parts was kind of people treating me differently because I was sick. And having my hair was a sense of privacy and normalcy. And it allowed me to always see myself even when I felt so disconnected from who I was. And it was really one of the greatest gifts I was given during this journey because it was my confidence. It was my self-esteem. It was an energy boost. It was one less thing. And so I felt so grateful for it. But then I also felt like, oh my God, how so many things had to go right for it to happen. And I think the cherry on top was that I got back to Duke and there was another person who had been diagnosed with Hodgkin's by the same oncologist, but because she didn't have a family friend, she lost all her hair. And whether or not she would have used it, she wasn't given the choice. And I think a lot of medicine for me is giving people choices and empowering them to make the choice that works for them. And so really that experience is what it was striking. It was really striking. I was at an academic institution before doing wig fittings, never heard about it. And I wanted to change that. And so this experience is really what fueled my desire to start Cap and Conquer. And I ended up my 2 sisters are also in medicine. So the 3 of us, and then Allie Whites was my family friend who pushed me to do it, a breast cancer survivor. A queen, literally so grateful for Allie Whites. When I make her listen to this, shout out. So we got her on board, and then we ended up getting connected to 2 other incredible cancer survivors, Janet Gendelman and Molly Powers. And so the 6 of us women all touched, my sisters, Taylor Novice and Carly Novice, I'll give them their shout outs too. The 6 of us really wanted to make a change within our community. So we started Cap and Conquer to raise awareness, but also to really be able to fund people locally so that cost wasn't a burden for them. And that's kind of how we got here. Sorry, that was really long-winded. There was a lot.
No, that was perfect. That was amazing.
Yeah.
You're amazing. And like,
thank you.
Your story is just like so inspiring. And also like, even, I don't know, I feel like you started this org like before we met. And so in my mind, like I've always known about scalp cooling. I've not known the ins and outs. And I was like curious a bit about the logistics, which you kind of explained, the like manual caps and stuff. But I was like, I always knew about scalp cooling.
I know, it's so funny. I feel like I'll talk to all these different like high up attendings. They've never heard of scalp cooling, but so many of our friends are all going to know about scalp cooling going in because I've like embedded it in your brains.
Literally. Which is perfect.
Literally.
I was gonna say, that's all incredible. My mom was diagnosed with cancer in 2007. I was only 10. And Scalp cooling was
Oh
definitely
my.
something that was never brought up to her. She had ovarian
Yeah.
cancer. Never talked about. Like I remember when she first got diagnosed and like had surgery and then started chemo, like we had like a scarf party because like we knew she was going to lose her hair. And like it wasn't like a question of like whether or not she's going to lose her hair. Like we were like, okay, you're for sure losing your hair. So then we had like a party with all of our friends and family where everyone like bought her scarves and bought her wigs and like bought her these things because it was just accepted right away that like you were going to lose
Yeah.
your hair. And I don't know if she even like knew about it in the beginning. And over the years, she went through so much chemo that I don't even think the scalp cooling would have been feasible. But
Yeah.
in general, like it was just never brought up. And like her doctor was amazing and like people love him. He's a great oncologist, but like it was never suggested by him. And then later on in her cancer treatments, like I would say like in the last 5 years, she said she saw a lot more people at infusion centers with the scalp cooling actually.
Oh,
And I would like,
interesting.
and especially when I was a med student at the same hospital that she would get infusions at, I would like run down during my lunch and hang out with her when I was on my rotations. And I would walk by like everyone else in the infusion center and there'd be so many people doing the scalp cooling. So it's just cool to like hear you talk about it and advocate for it based on my own experience of my mom who had cancer for 15 years at the very beginning. Like it just wasn't something that was talked about or considered. And so she went through hair loss and I watched her struggle with like being bald and then growing her hair back and then going bald again. And then like every time there'd be a new chemo, it would be, am I going to lose my hair this time or not? And like that was always like an indicator of like, oh, this chemo is good because I'm not going to lose my hair. So it's definitely like a huge conversation. So I think this organization is so interesting and cool. And like, you're right. So many people our age like know about it now. And like, we're the next generation of doctors. So it's so cool that like we can go on and advocate for that. I know I have like 5 friends who want to be oncologists and these are like things
That's
that they
amazing.
should know about going into it.
Yeah.
So you just do amazing work and your story is very amazing, even though you had to go through the hard
Thank
times, unfortunately.
Well, thank you. Thank you also so much for sharing about your mom. I'm
Yeah.
so sorry for the long journey that you guys had together too, but she sounds
Mm.
so strong. And what I will say is that it's very interesting because I don't know how you felt as a kid. And so you
Mhm.
could, but we find, so one of our co-founders, she had 2 young kids. And I find a lot of times when I talk to cancer patients with kids, that they really want to protect their children because it's hard for the family too. Like I know for me, I wanted to protect my mom in keeping
Mm-hmm.
my hair because I always felt like that would be so hard for my mom. Like I know she could handle it, but to see it's like a visual reminder for your loved ones too. And so it's
Mm-hmm.
actually very commonly talked about a way that, parents want to protect their children through that. But it is a journey with it, especially that the regrowth and re-loss.
Yeah, it's interesting, especially now. Like my mom passed last year, and so when we look
I'm
at
sorry.
pictures of her with my siblings, and we'll like look at pictures of when we were really young and she had a bunch of hair, and we're like, we don't really like
Well,
that.
yeah.
You're like, yes, that's mom, but like we don't connect with it as much. And then we see a picture of her
Mhm.
like bald, and we're like, that's mom. Like that's what we
That's
identify with, just because
yeah.
she went through that for the more majority of our lives. Like my sister was like 3 or something when my mom was diagnosed, so like that's what she knew my mom as. But you're right, like I think it's interesting for a family to like have someone lose their hair because it's just an indicator that like that person is sick and like or that person has something going on. And sometimes you like want to keep those things personal and you don't always want that to be like the topic of conversation when someone like just meets you or just meets your family. So it's so interesting how like hair plays such a large role in that, I guess.
No, 100%. And again, I'm so sorry for your loss of
Yeah,
your
thank you.
mom. But you're welcome. I agree. It's kind of goes back to that first thing that I said, that when my family thought it was superficial to care about hair loss, we were so wrong, like
Yeah,
so wrong.
it's not
And it's
superficial at
so
all.
not at all, but it's crazy. I actually am like trying to capture this because I do a funding call. We call patients all the time that we're funding for scalp cooling.
Mhm.
And I would say over 50% feel the need to justify or rationalize like the fact that they
Mhm.
want to do scalp cooling. Like I swear I'm not vain. I swear I'm not superficial. They feel so guilty for caring about hair loss. And so for me, a huge part is saying, no, it's a huge part of a person's story. It's a huge part of our image. And our image is how we feel about ourselves. How we feel about ourselves impacts our overall health. I feel like if we're at the point in life where we say in medicine, where we say holistic care matters, we have to back it up and back up
Mhm.
that our psychological health and our physical health are really just our health and they're just one. And one impacts the other and vice versa. And so for me, it's really recognizing that I get why people feel that way, but it's on us as physicians to make sure right off the bat we normalize it. Because I'll say to them, what are you talking about? So many people, this is a huge deal. And they say it feels so good to hear that. And so I feel like it's so important for more people to confidently and emphatically tell them, no, this matters. It's a big deal. And it's okay that you feel this way. And it's normal.
For sure.
Yeah, definitely. And actually kind of tying into what both of you have shared, in thinking about hair loss and like body image, and we kind of were getting into it already, but like what have been kind of, Maddie, you like spoke to it a little bit of, oh, you'll like talk to patients and they'll say, oh, I feel superficial. I feel like this shouldn't be something that matters. Like my health comes first. But like, I'm curious of the patients that you've worked with in your organization, maybe patients you've worked with at the hospital, patients that you worked with even before you were in medicine. Like what have been your experiences personally and or professionally about in relation to like a changing body image, especially with women, and like maybe tying that into, we talk a lot about like femininity and like what that means and like what that looks like. And of course it's a different definition for everyone. And like some folks are like, yeah, this is great. I'm going to have my wig fitting and it's fine. And some people are like, I'm very distressed about it. So I'm just curious, like, what have been your experiences or any patient stories you can think of or examples that come to mind of like women kind of grappling with this idea of their body image changing, and like, what would you tell them or what do you say?
Yes. So I think that that's an amazing question. And I can think of so many different stories because I think it touches different people in different ways. What I will say is that, so in the sense of femininity, whether, you said bald warrior, and I think it's amazing because actually someone once said that. They said, I know some people can just be a bald warrior and that's amazing, but that's not where I'm at in my life. And again, I think that comes back with normalizing. There's no right or wrong way to approach this. For a lot of women, we have like a beauty, like comes with people say, like, I feel like my hair is so much of my beauty and my image and my womanness and my womanhood. And I feel like they feel that they lose that sense of self because so much of their self as a woman is tied into, and the ways society has made it for us, that our beauty and our looks and how we feel comfortable in the outside world. And so we've been set up this way to then be having that taken away from us. They feel like, who am I? Because that was so much of their self-worth, and there's so much of their looks and their identity was wrapped up in that. And you have to keep in mind that if you're talking about breast cancer patients, a lot of them might have had double mastectomies. So they've already lost their breasts. So now you're taking away a woman's breasts. You're taking away their hair. They're taking away so much of their sense of what it means to them externally to feel like a woman. And that's really vulnerable. And so I think in one sense, a lot of people talk about that. Like, I wish I could be a bald warrior, but I just feel like there's so much of my image is wrapped up in how my hair looks. And I've already lost my breasts. I'm already losing so much of myself. I'm losing my health. I'm losing my control. So I think it's the big picture of losing it all together. And then a lot too is you think about women in the workplace. It's really hard. So think about a job like real estate or sales. It is hard to be a woman. And unfortunately, a lot of time women are sexualized in these positions and they feel like their looks play into how they sell. And so I've had a lot of people that say to me, I can't be bald and doing sales. Like, I need to keep my look together. I need to keep my look together so that people aren't either uncomfortable by me or these things, because that's my livelihood. So if you're thinking about a real estate, medical sales, those have been two examples of people that are like, that would impact my work. A therapist. I had a therapist who was like, if I'm bald, someone's going to look at me like I'm sick, or if I look different, and it's going to shift the client interaction towards me. And I just want to be present for my patients. I don't want it to be about me. So there's so many different jobs. And I do say this because, and I do want to add, because I do think it is really important to note that this has historically really been talked about with women, but men really do care about hair loss too. And a part of me, a huge thing is also advocating for them as well. So it's that it's all patients, not just like individuals who identify as female, because men, it really does actually also impact them. And so that is just an important caveat I would like to note. But yeah, so I think that it's not only the way they think about themselves, but also the way they then interact in the workplace is like a huge thing for women.
That's so interesting.
Yeah,
I've never
that
thought
is
about
huge.
the workplace
I
part
had
of
never
it.
thought about the workplace.
No, the
That makes so
workplace
much
part
sense.
is no, the workplace part is actually huge. And I will say, even it's so funny. I like, then the other thing is too, like, I didn't have a mastectomy, and I'll say this because we're on a female podcast, but then you think about like sexual interactions, right?
Mhm.
I was 21 and I was dating someone. Sorry to my fiance for bringing this up. Love you, Charlie, but I was dating someone else. Sorry, Charlie. I was dating someone else. I had all these scars. I had a port in. So I don't know if like for people that are listening that don't know what a port is, it's basically just like an IV under your skin. So a way to connect to a big vessel in your body to get the chemo into your body quickly. It's like a central line, basically. So I had a port. So I have this little device bulging out of my skin. I have scars from my surgeries. I have no eyebrows, no eyelashes. I don't think I look very sexy, let's say, or at least I didn't feel very sexy. And I already felt this pressure, I would say, as I'm dating this person, and he was absolutely wonderful. But I felt this pressure that it's like, oh my God, they're already their senior year in college and their girlfriend is going through cancer and they're back home and they're just, all their friends are going out and living life. And then when I wanted to see him, I was so tired but I felt like this need to like want to like be like sexually present too. And I felt very limited in that sense. And I think having my hair was like, I couldn't imagine also not having my hair. With that being said, I would have risen to the occasion like anyone does, but it was just one less thing in that other way too. And for me in that intimacy, that was really important for me at that time.
Yeah.
Hope that's okay to share on the podcast.
Of course it is. No,
Whatever.
definitely.
Yeah.
And that's so real. Like that is,
It's so
I mean,
true.
I like lightly kind of talked about it in our little beginning, but it's like the sexual dysfunction and like the infertility stuff that you were saying, like is a whole nother like can of worms to open is
for
like
sure.
are two other huge aspects of this. And it's like, we like have not yet figured out great ways to like help these issues, but like with scalp cooling, like, and if that barrier is broken down to actually make that accessible to people, like hair loss could be one less thing that a cancer patient who is already enduring so much has to, like, one less thing they have to go through.
And you also, it's really important to remember, I always tell people this, is that you get a diagnosis and it's like a whirlwind, and then you're going through treatment and it's a whirlwind, and then all of a sudden they say scans clean, treatment done, off you go, and it's just like, wait, what? I have been being handheld by doctors for months. My life was put on pause and you're supposed to resume. And they call it the survivorship period. For me, that was the absolute hardest part. It was like going back in the world and trusting again in the sense that you were okay and you were healthy, and having to reacclimate while you were tired and you were scared and you were vulnerable. And so it's easy to say, okay, I can't worry about this right now because I need to get through my treatment. But I always say to think about yourself as you're going to get through treatment and what you want your life to look like after. Because for so many patients, it's also the years of regrowth after that are really challenging, because every single time you look in the mirror, you're like, oh shoot, I'm still a cancer patient. I'm still a cancer survivor, and all these things. And it's that constant reminder. And sometimes you just want to forget. And again, this isn't to speak for everyone. These are just like stories of many people. But I would say it's many, many, many people that feel this way. And so I think it's really important to raise awareness for that.
Yeah,
Absolutely. And kind of thinking about raising awareness and just like your long-term goals for Cap and Conquer. What do you hope for? What's your like dream?
Yes. My dreams. I have so many dreams. Okay.
I know. I'm like, if I could magic wand your dreams.
Magic wand them. I will say before I forget too, I want to add 2 caveats to the listeners that scalp cooling is only safe for solid tumor malignancies. So lymphoma, they include Hodgkin's in that group, but if you have like a leukemia or like certain blood cancers, you need the chemo to go everywhere, so you can't use it. That's one. And then 2, scalp cooling doesn't work for everyone, and so really to like make sure that they know that it's worth a shot, but you can't expect it to always work 100% of the time. And I just feel like those caveats are important for expectations for people that could be listening.
I think that's great.
But now,
and actually, wait, quick add-on or like additional question that I had. How long or like how do you know if the treatment is like working?
yeah, it's a great question. So I would say based on most people, at least with like common breast cancer treatments, they lose their hair around like, oh my God, why am I blinking? Like maybe like 18 days. Yeah, like I would say like 18 days. Around that time, like 18, 21 days, like around 3 weeks, they typically say. So you will shed, like you will lose your hair. You can lose up to 50% of your hair and no one would notice, which is super important for people to realize. And so you will shed. I always say you should expect to shed, but if you're losing like patches, like bald spots, that means that the cap's not tight enough there. And obviously, if by your second treatment you've lost most of your hair, it probably wasn't working for you.
Okay. No, good to know and helpful.
Yeah.
And
Hopes
again,
and dreams.
this is not like this podcast has never been medical advice, but it is supposed to hopefully give you information to help you be more aware of things. And so important caveats. We appreciate it.
Disclaimers. Okay, now hopes and dreams. Yes, so my biggest so many hopes and dreams with Cap and Conquer. So basically a lot of the research that we've been doing has been trying to get data to show how expensive cold caps are and to show how they can benefit quality of life because it's really hard to test that. So hopefully we're able to get insurance coverage. So there's amazing cap companies and other nonprofits that are working at this and many advocates across the country and the globe. And so there have been some CPT codes that have been released. They're really challenging to use based on a lot of like nuanced details that we don't need to get into. But hopes and dreams would be that we can get this covered by insurance so that any patient that wants to use scalp cooling can. So that's kind of number one. My next other big hope and dream is that a lot of research with scalp cooling has been done in Caucasian populations because a lot of it was done in Europe. And so there's very limited data for skin of color patients and how different hair types, in Durham we say like types, like 3, 4, 5 hair, whatever, but like it's like curly, coily hair, how we can make it more successful for them so that it's not, again, another disparity in access that we have so many of in medicine. How can we make this more accessible and successful for all patients? So I think increasing research in all types of patient populations and hair types, that's really important for me and something that a lot of people are working on as well. We actually at Cap and Conquer have like, it's really nice. A lot of patients, a lot of our patients, like a lot of our Black patients who have successfully used scalp cooling actually will now talk to new patients that are applying because we've had oncologists be like, oh, it won't work for you, which is like a stab in my heart, but whatever. What is a knife to my heart? That's the saying. Yeah, it's a knife in my heart because it's like, no, we have to try and we have to try to make it work. So we've created a network of patients with similar hair types that will talk to each other and give each other tips, which is really nice and wonderful. And I'm so happy to have that. So expanding that will be super important to me. And then working on getting more machines at more institutions and really making it so that you walk into, there was like some law that I wrote about in one of my papers, I can't remember, but they made it so that mastectomies and like post-mastectomy cares, all those things were covered by insurance. And if we can make this covered by insurance, it should be streamlined that you walk in, oh, you're going to lose your hair. You could use this thing called scalp cooling. Great. This is what we need to do. Done. It's a streamlined process. There's no like, it's just easy. And then it's covered by insurance and then we're done. We're ways away from that, but magic wand it, that's my goals.
That would be amazing.
That's awesome. Yeah. That's funny when you mentioned the insurance. I immediately thought about how mastectomy, like reconstruction, is covered by insurance because I did a plastic surgery rotation and the surgeon did mostly like breast cancer reconstructive surgeries. And she was saying like you could be like 10 years like still no cancer, getting reconstructive surgery and just like fixing one breast and it's still covered by insurance. Like it'll cover everything for like ever, it sounded like. So that'd be amazing.
It's crazy.
It was the scalp cooling could be.
Was it the 1980s? I'm not sure. It was like not recent, but not that long ago, law that was passed, and it changed the game and increased use of like post-mastectomy reconstruction exponentially. And so it shows you how so much of it is getting institutional federal support for these things to really make a change. Once you get it in the laws, then you can really get, and a lot of it's also debunking the stigma that hair loss is about like is a matter of superficiality and that this is a cosmetic concern. And I mean, obviously a lot of, like, going into dermatology, that's something I'm really passionate about because a lot of dermatologic conditions can be deemed as cosmetic concerns. But think if any of our conditions were manifested externally, people would care a lot because that's how you interact with your world, how the world sees you and how you see yourself. And so it's really important to normalize that for patients and try to, get those old school docs to see this as a big deal.
You're going to be such a great dermatologist.
I know.
Oh my gosh,
so
thank
cool.
you. Wait, the coolest part is that I used to be like, I hope so. But now I actually am going to be one. So that's awesome.
I know.
I mean, you guys are.
We've been saying that too on the podcast.
I know.
Yeah.
We're like,
we are
recorded this a month
OBGYNs.
later. We would have been like, this is Dr. Madison Novice. But I'm like,
I know.
not yet.
Wait, also, can you guys God willing, I can have a baby. Can you guys co-deliver my baby? Like, that would be amazing. I want to join.
I'm happy to. We'll tag team it.
Best OB guys.
So
love
fun.
it. So
our last question for you, which we kind of have been getting at, but just to hit it home as our last point, is if you had 3 big takeaways that you would want to give our listeners regarding your work or just something they can take out into the world, 3 pearls, what would they be?
Yes. Ooh, good question. Okay. I think that one is hair loss during chemotherapy is such a big deal for patients and it can really impact their psychosocial well-being, and it's not a matter of superficiality, and it's so important to debunk that stigma to better the world for all patients that are going through such a challenging journey. So that's number 1. 2 would be that scalp cooling is a thing. Scalp cooling exists. It's a treatment that can help reduce hair loss during chemotherapy. It's not effective for everyone, but it can make a big difference for those who it is successful for. And 3 would just be, let me think of a good third one. I would say something about cap and conquer, but I think that my last thing is that you never know what someone else in these journeys are going through. And it's so important I never even realized I would feel certain ways about certain aspects of my cancer journey until I went through it. And so just always be kind and open-minded with people in such vulnerable moments of their life. Obviously, that can translate in many ways, but people are really struggling in different ways than you might ever realize in this process. And so just being supportive and kind and recognizing that if they feel that way, that's okay. And to support the people around you in that journey in that way. That's really special.
That's perfect. That's amazing.
Yes.
Maddie, thank you so much for being with us. Do you have any last things you wanted to say, Charlotte, or any last questions?
No, that was all amazing. I'm so happy we finally got you on the pod.
We've
been talking about it for so long.
I'm so grateful. I feel like a celeb being with you guys. Like, this is amazing. No, I'm seriously so grateful that you guys gave me this space to also share so many important stories and notes about hair loss and also about scalp cooling.
Yeah, no, we are very grateful. And just everyone listening, keep in mind Cap and Conquer. It's an amazing organization. We'll link, we'll have their information in our show notes and in our bio so that you can see what all the work is that they're doing. They have an awesome golf outing coming up.
I was gonna say, when is this gonna be released?
Probably
I have the date written down.
I wrote it down on my it's May 7th.
Amazing. Yeah. So guys, in almost 1 month, we will be having our 4th annual golf outing, June 10th at Tamo's Chanter Country Club in West Bloomfield. And check out our Instagram and our website to learn more.
Yes, nice. We'll be tagging them. We'll be linking their website in our bios and everywhere so you can check them out and check out the work that they are doing. All right. We'll see you later, Maddie.
Bye, guys. Thank you. Thank you, everyone.
Thanks for coming.
All right. So if you liked that episode and you wanted to hear more about the work that Cap and Conquer is doing or that we're doing, you can subscribe to our podcast and leave us a rating and review. And Apple Podcasts is the best place for that, but you can also check out Spotify and other locations.
Yeah. And then you can also follow us on social media. We have Facebook, Twitter, TikTok, Instagram, YouTube now. Follow us on all the things. You can also check out our website for more information. We have show notes, sources, links to our merch, and more at FromSkirtsToScrubs.com. And lastly, here is to the women who have fought for us to be where we are today. May we do the same for those who come after us. All right, everyone.
See you next time, everyone.
Bye.
Bye.